Making sense of the psychiatric assessment. Welcome back. Psychiatric assessment can feel overwhelming at first. There are a lot of questions, a lot of symptoms, and a lot of pressure to get it right. But here's the truth. Strong nurses don't memorize assessments. They learn how to think through them. Seeing the pattern. Psychiatric assessment is not about collecting all the information. It's about collecting the right information and understanding what it means. Before we diagnose, document, or prioritize, we have to learn how to see.
When you meet a patient, your brain should be asking 3 questions. What stands out? What feels unsafe? What doesn't quite fit the story? This is called recognizing cues, and it's the first step in clinical judgment. One symptom alone doesn't tell you very much. Patterns do. Anxiety, depression, trauma, psychosis, and even medical conditions all show up as patterns over time. Nurses don't jump to conclusions. We slow down and look for patterns.
If you remember nothing else from this section, remember this. Don't chase symptoms. Look for patterns. That's how nurses begin to think clinically. Thinking differentially. Once you recognize patterns, the next step is asking a critical question. What could this be? Before assuming a psychiatric diagnosis, nurses always think differentially. Could this be medical? Could this be substance-related? Could this be trauma or situational stress? Or is this primarily psychiatric?
Ruling things out is not hesitation. It's clinical strength. Some medical conditions look psychiatric. Some substances mimic mental illness. Strong nurses ask better questions before narrowing conclusions. We compare patterns not to label patients, but to keep them safe. Depression, anxiety, and trauma can overlap, but they don't look identical. Context, duration, and functioning matter.
Thinking differentially protects your patient, and it protects you as a nurse. This is clinical judgment in action. From thinking to charting, priorities, safety, and documentation. Clinical judgment doesn't stop at assessment. It continues through prioritization and documentation.
You may identify several problems during an assessment, but nursing judgment is about priority. Safety always comes first, then physiologic stability, then functioning, then coping and supports. The mental status exam is evidence, not opinion. If you can observe it, hear it, or quote it, document it. If you can't, leave it out.
Good documentation tells the patient's story. Why are they here? What patterns emerged? What risks exist? And what is the nursing priority? If another nurse can safely take over care from your note, you did it right.
This is how psychiatric nurses think. We notice, we look for patterns, we prioritize safety, and we document with intention. You're not expected to be perfect. You're expected to think, and that's what makes you a safe, effective nurse.